Welcome to Health U. Major breakthrough in men's health. Prostate enlargement is no longer an incurable disease. Latest anatomical and embryological research reveals shocking truth. 90% of men over 70 have this problem. But now we've finally found the key answer. Dear viewers, today we're sharing an important health topic affecting hundreds of millions of men worldwide. Prostate enlargement, medically known as benign prostatic hyperplasia, or BPH. While this condition may sound unfamiliar, it's one of the most common urinary tract diseases among middle-aged and elderly men. Let's start with some stunning statistics. According to the latest medical research, the prevalence of prostate enlargement in 60-year-old men reaches 50 to 60%, while men over 70 see rates increasing to 80 to 90%. This means nearly 9 out of every 10 men over 70 will face this health challenge. But what is the prostate? What role does it play in our body? The prostate is a walnut-sized organ located at the base of the bladder, tightly surrounding the urethra. Imagine if you compare the bladder to a water bucket. The prostate would be like a ring-shaped structure wrapped around the bucket's outlet. The prostate's location is extremely critical, as it directly surrounds the urethra and sits below the bladder. Because of this special anatomical position, when the prostate becomes enlarged, it directly compresses the urethra, causing urination difficulties. It's like a water pipe being squeezed by external force. The water flow naturally becomes weaker. Let's delve into the prostate's development process. Prostate development follows common patterns across different species, a process entirely dependent on androgen action. From an embryological perspective, the prostate develops from buds that sprout from the urogenital sinus, undergoing complex ductal branching morphogenesis through androgen induction and support. The prostate has two major growth phases. The first occurs in early puberty, when the prostate volume doubles. The second growth phase begins around age 25 and continues throughout life. This explains why prostate enlargement mainly appears in middle-aged and older men. Benign prostatic hyperplasia refers to non-malignant growth or hyperplasia of prostate tissue. This is a histological diagnosis characterized by proliferation of smooth muscle and epithelial cells within the prostate. Importantly, this hyperplasia mainly occurs in the prostate's transition zone, the specific area surrounding the urethra. Regarding the causes of prostate enlargement, the medical community has proposed three main theories. The first is the dihydrotestosterone hypothesis, based on an important finding. Men castrated before puberty do not develop prostate enlargement. This emphasizes the crucial role of androgens, particularly dihydrotestosterone, in disease development. The second theory is the embryonic reawakening theory, hypothesizing that reactivation of embryonic inductive potential in prostate stroma is the key mechanism for prostate enlargement development. Simply put, the adult prostate returns to its embryonic developmental growth state. The third is the stem cell theory, suggesting that prostate enlargement develops through abnormal increases in stem cell numbers or abnormal clonal expansion of cells. However, the latest 2024 research brought surprising findings. Studies show no evidence that testosterone or dihydrotestosterone play key roles in prostate enlargement initiation. So what's the real cause? Researchers now speculate that years of exposure to unidentified urinary toxins may be the culprit. Since prostate enlargement specifically occurs in the transition zone around the urethra, scientists believe long-term exposure to certain toxic substances in urine may disrupt the normal balance between stromal and epithelial cells in this prostate region. This discovery completely changes our understanding of prostate enlargement and provides new directions for future treatment approaches. What symptoms does prostate enlargement cause? Medically termed lower urinary tract symptoms, or LUTS. These symptoms fall into two categories: obstructive symptoms and irritative symptoms. Obstructive symptoms include weak urine flow, incomplete bladder emptying, and difficulty urinating, like a blocked water pipe making it hard for urine to flow smoothly. Irritative symptoms include urinary frequency, urgency, and nocturia, where patients frequently feel the need to urinate, especially requiring multiple nighttime bathroom trips. About half of men diagnosed with prostate enlargement report moderate to severe lower urinary tract symptoms, seriously affecting their daily life and sleep quality. Imagine having to get up 5 or 6 times a night to use the bathroom. The next day's work and life quality would inevitably suffer greatly. Let's look at risk factors. Many studies show that aging and obesity are major predisposing factors for prostate enlargement. Data shows that for every 1 kilograms per greater increase in BMI, prostate volume increases by 0.4 milliliters. More shocking is that obese individuals with BMI greater than 35 have a 3.5-fold increased risk of prostate enlargement. This finding tells us that maintaining healthy weight is important not only for cardiovascular health, but equally crucial for prostate health. In animal model research, scientists discovered an interesting phenomenon. Human prostates are common sites for benign hyperplasia, prostate cancer, and prostatitis, but rodent prostates rarely have naturally occurring diseases. This difference stems from anatomical structural differences. Human prostates have tight regional anatomical structures, while rodent prostates are lobular with lobes radiating outward from the urethra. Although rodents can be used to model certain aspects of human prostate enlargement, extra caution is needed when interpreting data and extrapolating to human conditions. Good news is that modern medicine has made major breakthroughs in treating prostate enlargement. In 2024, a new treatment called paclitaxel-coated prostate balloon dilation received FDA approval, becoming a new minimally invasive treatment option for prostate enlargement. This treatment method works by using a special balloon to expand within the prostate while releasing paclitaxel medication to prevent tissue regrowth. Compared to traditional surgical treatments, this method causes less trauma and faster recovery, providing patients with better treatment options. Based on deep understanding of prostate anatomy and embryology research, modern medicine is moving toward more precise individualized treatment. Doctors can formulate the most suitable treatment plans based on each patient's specific situation, including prostate size, symptom severity, age, and overall health status. For prevention, while aging is an unavoidable risk factor, we can reduce prostate enlargement risk through weight control, regular exercise, and healthy diet. Research shows that Mediterranean diet patterns, rich in vegetables, fruits, whole grains, and healthy fats, have positive effects on prostate health. Regular health checkups are also very important. Men over 50 should receive annual prostate-related examinations, including digital rectal examination and prostate-specific antigen PSA testing. Early problem detection enables early treatment intervention, avoiding symptom deterioration. For patients already experiencing symptoms, besides medical treatment, lifestyle adjustments are also important. Avoiding excessive coffee and alcohol consumption, reducing fluid intake before bedtime, and regular pelvic floor muscle exercises all help improve symptoms. This comprehensive prostate anatomy and embryology research not only deepens our understanding of normal prostate development and disease mechanisms, but also provides a solid scientific foundation for developing new treatment strategies. Future research will continue exploring the urinary toxin hypothesis and new therapeutic targets, making greater contributions to improving global men's health. From a public health perspective, prostate enlargement is not only a personal health issue, but also a socio-economic burden. With global population aging, this problem will become increasingly important. Raising public awareness of prostate health, promoting prevention measures, and investing in related research are all urgent tasks. In summary, while prostate enlargement is a common disease among middle-aged and elderly men, with continuous medical research progress, our understanding of this disease grows deeper and treatment options become more diverse. From traditional medication to the latest minimally invasive surgery, from lifestyle adjustments to personalized medicine, we have more weapons to fight this disease. Most importantly, don't ignore prostate problems due to embarrassment or thinking it's normal aging. Early detection and treatment not only improve quality of life, but also prevent complications. Men absolutely cannot neglect prostate health. This research represents important progress in modern urology, providing key insights for understanding prostate enlargement disease affecting hundreds of millions of men. With continuous technological development, we have reason to believe there will be more breakthrough discoveries and treatment methods, allowing men to live each stage of life more healthily and with better